So I'm excited to go ahead and get started with today's webinar. Uh, just as a background, let me let everybody know that I am Brian Sanderoff and I am a regularly trained pharmacist. A good while ago, I stopped practicing traditional pharmacy and started practicing what I affectionately call holistic pharmacy. And so I have a wellness center and a holistic pharmacy in Hunt Valley, Maryland, and I do these webinars on a monthly basis as in an attempt to help educate people about things, because my firm belief is that the number one killer in this country is not heart disease, it's not cancer, really it's misinformation. And the mission of my work is really to help people understand the true ramifications of their decisions. If you really understood what the result of a behavior or a choice was, and you said, you know what, that's okay, then, I don't have any problem with that. But it's my belief that a lot of us make decisions based on faulty information, and then we get results that we didn't expect. And that's the case with what we're talking about today as well, which is attention issues. I wrote attention issues instead of ADD or ADHD. I'm not big on labels, but you'll hear me use those terms throughout this presentation today because that's the way we're taught to think about them, and that's how our medicine works, and that's how our insurance works. You're also going to hear me today talk a lot about children and results of studies. Understand that every one of those studies, although may not have been done on adults yet, can be extrapolated to adults as far as the results go and the causes go. There's just a lot more attention having in the past been given to children with attention issues, ADD and ADHD, than there are adults. That's a relatively new, I don't say discovery, but recognition, I guess is the right word. And studies will follow after that, but a lot of the studies have been done on children. So here we go, attention issues in children and adults. So first of all, let me give you some quick facts about ADHD. Now, you'll hear me say this. Officially, all forms of attention issues are known as ADHD, even if there isn't a hyperactive component to it. So you'll hear me refer to this as ADHD just for simplicity's sake. So here's some quick facts. Number one, it's found now in up to 15% of children. In fact, I went through the CDC website this morning, and they have a list of percentages state by state, and it goes up to 15% of children in the United States. It happens much more prevalent in boys than it is in girls. I think that's interesting, and I'll have a comment about that a little bit later, but 3-to-1 as far as boys to girls go. ADHD is actually responsible for over half of all childhood medical referrals, many of those coming from school as our kids are in school, and I'm sure some of the people in the audience have experienced that or know people have experienced that. The way that we diagnose this has to do with a list and some information that comes from what's known as DSM-5. That's diagnosis and symptom of mental disorders. There's like a big consortium that meets every so often, and the 5th version of that came out recently in 2013. There were really no changes to the diagnostic criteria, except for they expanded it into now adults. And so it's much more recognized, ADHD is much more recognized in adults. And that can be helpful when it comes to insurance covering tests and, prescription medicines and doctors prescribing medicines for ADHD. As you'll gather, and maybe many of you know already, I'm probably not the biggest fan in the world of those medicines. So how about a definition of ADHD? Well, it's a condition characterized by developmentally inappropriate inattention and impulsivity with or without hyperactivity. Now, officially, all forms are known as ADHD, and there are 3 main subtypes. There's one that's called predominantly inattentive. There's one that's called predominantly hyperactive/impulsive, and then there's the combination of those 2 things. So even if it's just an attention issue and there's no hyperactivity part to that, it's still known as ADHD officially. The inattentive is, defined as being easily distracted, forgetful, daydreaming, disorganized, poor concentration, and difficulty completing tasks. The hyperactive impulsive part, excessive fidgetiness and restlessness, hyperactivity, difficulty waiting and remaining seated, immature behavior, destructive behaviors may also be present. Commonly, these sorts of symptoms are accompanied by other conditions like mood disorders or learning disorders, which can be part of the difficulty in diagnosing exactly what's going on with somebody. So again, the diagnosis is very difficult. There's no one quote unquote test to confirm this, like there would for blood sugar and diabetes or high blood pressure that you get on a meter. There are some noted changes or altered functions in the part of the brain where executive functions are controlled. It's called the prefrontal cortex. And it has to do with important neurotransmitters, chiefly dopamine. And we do see differences in brain scans or EEGs among people who have ADD or ADHD. But these tests are only used in research. Those tests are not used for diagnostic purposes. I see that Jennifer is raising your hand. Jennifer, I can't talk to you straight. So if you have a question, type it into your question box on the control panel, and that'll show up right on my screen right as I'm doing it. Okay. It's also controversial because I have a question. Number one, who does the diagnosis? Oftentimes, the impetus is coming from teachers in school. And I've always wondered, is it possible that our expectations for our kids in school these days are really not reasonable? And when you heard me talk about immature behavior, a lot of the opinion of what a behavior is very objective. One person's opinion may be different than another person's, and that's part of the controversial part of this. There's also some political reasons. In Europe, they have completely different criteria versus the US, and that also has some insurance implications because I think there's a money part of this as well. As drugs come out to treat a particular disease, the companies that make those drugs want there to be official diagnosis for those diseases so that there's a justification for prescribing and getting reimbursed for those medicines. And so there's a big political component to this as well. It also can be very confusing because there are many other quote unquote psychiatric conditions that show up with similar symptoms, including things like anxiety, depression, bipolar, OCD, various learning and language disorders. And then there's also the whole spectrum that goes from Asperger's to autism, which show very similar kinds of symptoms or behaviors that we would see in ADD. And in fact, some practitioners actually feel that ADHD is really just part of that same spectrum that includes Asperger's all the way up to autism at the other end. But basically, according to the DSM-5, the criteria to diagnose ADHD is meeting 6 of 9 very specific criteria. I just want to read them to you real fast because I want to make a point about them. So number 1, often fails to give close attention to details or makes careless mistakes in schoolwork, at work, or with activities. Often has trouble holding attention on tasks or play activities. Often does not seem to listen when spoken to directly. Often does not follow through on instructions and fails to finish schoolwork, chores, duties, or workplace, etc. Often has trouble organizing tasks and activities. Often avoids, dislikes, or is reluctant to do tasks that require mental effort over a long period of time, such as schoolwork or homework. Often losing things necessary for tasks and activities like school materials, pencils, books, whatever, keys, is often easily distracted and is often forgetful in daily activities. And so one of the issues that I have with this whole thing about, and again, it's more of an insurance thing and a doctor thing than anything else, but is that term often, because I know that there are those of us who have different levels of tolerance, and I've seen teachers who have different levels of tolerance with their kids in school, and some of them have expectations that I think are maybe a little bit less reasonable than should be for the age of our children in school. And so this is where I say it's confusing and even controversial, because if you get a teacher that has higher expectations, they're going to have a tendency to, think that the kids that are in their class are more likely ADHD, because they don't want to sit and, maybe even be bored by whatever topics being taught right now. So anyways, that's just a little bit about the diagnosis and how it's done officially. What are the potential results of ADHD? Well, with children, you're talking about things like potential academic impairment, increased risk of injury, low self-esteem, poor socialization skills, and all of these things are really, really important to me, because we send our kids to school and they start to get a sense of themselves as compared to other children, and as the adults that are around school respond to them. And it can turn into a sort of a self-fulfilling prophecy, where a child may start to feel down on themselves because their abilities are different than other children in the class. And sometimes that can happen just because of a maturity level and an age difference in class. The younger kids that are in a particular grade might be what might seem like significantly less mature in the beginning of the school year, and maybe they catch up by the end of the school year, and then they go through it all again the next year. But when their self-esteem starts to get beat up, then they start to maybe act out more, or it leads to more behaviors. In adolescents and adults, we see an increased risk of psychological disorders, potential for substance abuse and other addictions like shopping, or sex and drugs and rock and roll, or whatever. We see more traffic accidents and financial problems and vocational underachievement, social dysfunction, even difficulties with the law are all much more common in adolescents and adults who have ADHD. Also want to point out that there is a big genetic component to this. And there have been many genes that have been identified as playing a role with this. So there are genes that are controlling dopamine transmission. And dopamine is one of the main brain chemicals that we're concerned about here, that seem to result in, when low levels of dopamine exist, that seems to result in all of those symptoms that I had just gone through. So there are genes that are either controlling dopamine transmission or controlling the reuptake of dopamine, which then means that there's less around to be used. There are also genes that play a role with allergies and immune function and detoxification, and I'll talk about the importance of that in a couple minutes. There's evolutionary adaptation that plays a role with this as well, and this I think is really kind of interesting. This is the biochemical research nerd in me that thinks that this is really kind of cool. Maybe you will as well. Certain genetic traits towards attention issues may have actually been beneficial to society when it comes to adapting to environment, even if it was detrimental to an individual, because the tendency to sort of get bored and maybe explore further than what were normal boundaries would have allowed to find new areas, to find new food sources, etc. So back in the day, even going back to caveman times, someone that had a genetic predisposition towards wanting to explore and getting bored with what was the status quo may have actually contributed to society in general sort of spreading out, finding new areas, finding new foods, and ultimately making new discoveries and things. I think that's kind of interesting. Let's see, I have a question from Lori. It says, would the child with ADHD be able to stay on task with things they like and enjoy, or would the signs and symptoms be the same on all tests? It's a really good question, Lori, and that's always one of the questions that I ask parents when they come to me saying, hey, we got a note from school saying that our kid has an attention issue. One of the first things I say is, hey, when your child is at home doing something that they're really interested in, are they able to sit down and stay focused and concentrate and stick with a task? And lots of times the answer is yes. And when they say that, my response is, well, then maybe it's a teaching deficiency as opposed to a learning deficiency. Maybe what our expectations of our kids in school while they're sitting around learning something that they're not interested in, I know I certainly, don't feel like sitting and listening to something that I don't have any interest in. So I think that's one of the big problems with identifying this issue with people. Back to the evolutionary adaptation, also risk-taking. the tendency towards risk taking, which is one of those kind of genetic tendencies that we would put under the ADHD label, that in males might actually have been more attractive to women, which would then further that specific gene once upon a time. And so the bottom line is yes, there is a genetic component from various different perspectives to ADHD. Okay, so let's get into some of the factors that really play a role with this happening. So number one are environmental factors, and I've broken this up a couple different ways. Number one is maternal exposure. So I'm talking about exposures that mom got when the child was a fetus just being developed before the baby was even born. The transport of these environmental substances from mom to fetus happen very, very easily. So we're talking about things like tobacco and alcohol and something that's called xenobiotics. And so xenobiotics are chemicals from the outside world that have an effect biochemically or biologically in the body. So I'm talking about things like pesticides, heavy metals, solvents, PCBs that come from plastics. They're all neurotoxic, and exposure to these things may cause not just ADHD symptoms in mom, but during fetal development may cause permanent changes in brain cells leading to the same symptoms and worse in the child. Heavy metal exposure to the fetus can even come from mom's amalgam fillings in her teeth. Lots of studies have shown that you've heard of fetal alcohol syndrome, exposure to tobacco, or even secondhand smoke have all resulted in behavior issues in the children that have happened. It's not saying that every mom that's pregnant and gets exposed to these things that happens in the children, but it's a common occurrence to happen. Studies has also shown that jet fuel residue is found in human breast milk. And so my point in saying that is that you can't avoid being exposed to some of those things in the society that we live in these days. Doesn't matter where you live. We're finding it in blood and all of that stuff. There are childhood exposures. So we're talking about the same sort of chemicals, especially heavy metals. So lead, mercury, cadmium, aluminum, pesticides, PCBs, and again, those comes from plastic. So if we're drinking water from bottles, or plastic bottles, or if we're microwaving food in plastic containers, those plastics leach into the food, and then we get into our body. They come from, again, dental amalgam fillings. They come from food, water, air, and are nearly impossible to avoid. These all are known to cause impaired neurological function and development in certain susceptible children. And this is where that genetic part comes in. But it's hard to know which individual child will be more or less susceptible. A study was done on 56 autistic children looking for heavy metal burdens in their body, and 100% of the test subjects demonstrated elevated body burdens of heavy metals. It's very interesting. 95% of those autistic children also exhibited highly significant elevations in a wide range of organic xenobiotics. Those are those things that we get exposed to through our water and our air and our food. Functional liver detoxification testing was also markedly abnormal in 98% of these kids. And again, that can be a genetic component, but it points to the fact that one of the factors that may make a child more susceptible to having ADHD, as well as many other things, is that genetically they do not detoxify as well as other children. Their liver doesn't work the same way. And so you may have two children that have the exact same exposure. One can end up with behavior issues, including things like ADHD, or again, if you want to take it to the extreme, autism. And the other one, no problem. And so when we look at that, we have a tendency in medicine to say, well, it wasn't the mercury that they were exposed to then. But that's not the case. The case is that one of those children may not have been able to get rid of that mercury or cadmium or aluminum or PCBs or whatever those xenobiotics are as efficiently as the other one, and that's why they got neurologically affected. It's the same thing with vaccines. You see, I wrote vaccines there. And it's the same thing. Some children get their vaccines and don't have any problem with it, and other ones seem to. It's hard to say, okay, this child ended up autistic or less severely Asperger's or less severely ADHD. It's hard to look at that child and say, okay, that was from the vaccine, because so many other children got a vaccine and they didn't get that problem. But it is the vaccine. It's the vaccine combined with certain genetic tendencies that didn't allow that child to slough off the potential negatives of that vaccine, if that makes sense to you. So there is mounting evidence that the whole autism spectrum is really just a result of environmental exposures, either fetal or in early childhood, and in children with impaired ability to detoxify properly. And so understand that as a fetus and an infant, the blood-brain barrier is poorly developed, meaning that the protection of what should not be able to get into the brain in the first place is not as good as it is as we get older. That's because when we're an infant and when we are a fetus, we're relying on the mom's exposures to be limited. And in today's society, that's just not the case. So again, vaccines are another potential exposure for things that may affect development and genetic expression. Then there's a whole host of potential nutritional deficiencies. As you can see there, I've written down essential fatty acids, magnesium, zinc, iron, B vitamins. I'm going to go through those a little bit in detail because it's important to understand why and how these are affecting things in the body. So many studies have shown that children with ADHD have a measurable reduction in tissue levels of DHA, which is one of the very important omega-3 fatty acids when compared with age-matched controls. DHA is one of those fats that comes from fish oil. Because essential fatty acids in the brain are critical in neuronal structure and function, it makes sense that deficiencies would affect function. And so in simple terms, these healthy fats help brain cells and nerve cells communicate appropriately, and the lack of them interferes with that appropriate communication. Studies have also shown that moms that supplement with healthy fats, like fish oil, when they're pregnant and when they're nursing, have children with less tendencies towards behavioral issues, including ADHD, and also less allergies and immune issues. Interestingly enough, studies have showed that moms that supplement with fish oil also have offspring that have a tendency to have a higher IQ, which is, again, the same indication that brain cells are communicating with each other better. Magnesium, it's commonly deficient in the standard American diet. And studies have shown that a majority of children with ADHD have low levels of magnesium in their serum, in their blood, and in their hair. Importantly, though, is the fact that many of these children demonstrated improvements in behavior when given magnesium as a supplement. It's the same with zinc and iron and the B vitamins. So understand that a processed and refined food diet is traditionally poor in many of those nutrients that you see there, including magnesium and zinc and the B vitamins. So the key isn't just to take supplements. We certainly give our kids or our adults that have these problems these supplements, but the key is also to change the diets in the various ways, and I'll discuss them in more detail later on, including the effects of sugar on the body, especially in relation to attention, because I think there's been a big misunderstanding about that, and I'm hopefully going to clear that up for you also. So next I want to talk about the gut connection, because there is a huge connection between gut function and brain function, as I've discussed in this space many, many times before. There is more neurotransmitter activity in your gut than there is in your brain. The gut is truly your first brain. So anything that affects gut function will affect brain function, especially in the realm of attention issues. So number one is the good bacteria. We also, if there's an imbalance of the good bacteria, it's also called dysbiosis, gastrointestinal dysbiosis, which is just a fancy Latin term for saying an imbalance of what's growing there. An imbalance can be caused by many, many factors. Fixing it is usually easy enough. Chronic antibiotic use is one of these factors, and it's a common occurrence when children have a tendency towards infection, young children, especially ear infection, and they're given the antibiotics like amoxicillin. So understand two things here. One of them is that having the constant infections, lots of ear infections or whatever, as kids are growing up, is an indication that there's probably a genetic tendency towards that problem, meaning that genetically they don't protect themselves as well. And then when we give antibiotics, we beat up the good bacteria that's in the gut, and that is furthering the tendency towards having attention issues. And again, you can take that all the way down the line to autism as well. And so it's like a double whammy, or it's like one thing leads to the other, which leads back to the first thing. I did a whole webinar about probiotics. Very important. My feeling is that's one of the essential six, and that people should be taking a probiotic every day, especially if there are attention issues. And again, not just kids, but adults as well. Getting that gut back into shape is very, very important. The next topic is called leaky gut, and this is also known as intestinal hyperpermeability. And in essence, what it means is that the gut is supposed to work as the ultimate gatekeeper. You eat something, it goes into your stomach, your body breaks it down as best it can, and then the body determines, okay, you are a vitamin, you are a mineral, you are a fat, you are a sugar, you get to come in. And then something else that didn't get broken down properly, and partially digested protein, or one of those xenobiotics like a PCB, something that leached in from plastics or jet fuel or whatever. The gatekeeper is supposed to say, no, you don't belong in here. You keep going. And we eliminate it without it ever getting absorbed into our system. Well, when we get this thing that's called leaky gut, what that means is that actually the gatekeeper isn't working, and it's letting things in that have no business in your body. This is usually a result of several different factors. Number one, sensitivity to certain foods, some nutritional deficiencies, an imbalance of the good bacteria. Maybe the most important factor really here is stress, because when you're under stress, blood gets shunted away from your gut. Again, did a whole webinar about stress. You can go in our archives, and I'd encourage you to, bone up on that if you're not familiar with it. But one of the results of stress is shunting blood away from the gut, because when we're under immediate stress, like a life, threatening event happening, we need to run or fight. We don't need to digest food. But when we're under chronic stress, we're constantly shunting blood away from our gut, which means those gut cells don't reproduce the way they're supposed to, because they don't get all the nutrition that they're supposed to. And then they don't work the way they're supposed to. Maybe the most important factor, again, is stress. Inflammation in the gut causes the release of certain chemicals, mediators of inflammation, which also increase the permeability of the blood-brain barrier. So again, if you've got leaky gut going on and there's inflammation within the gut, one of the possible potential effects of that is that all of a sudden the blood-brain barrier isn't shored up as well as it should be, and then chemicals that shouldn't be able to get into the brain, even if they got into your body, can get through that barrier as well, and then it affects function of neurons, your brain cells. And that, in some susceptible people, ends up with attention issues. Also understand that issues along these lines in moms can affect their developing fetuses even before they were born. So get this. If you as a mom are pregnant and you're under stress, the physiological effects of that stress are felt by and in the fetus, and the baby starts to get a different set of biochemistry based on those physiological changes. If you want to think about that in different terms, if you are somebody that has a tendency towards attention issues as an adult and you're listening right now, take some time to explore what life was like and the situation was like when your mom was pregnant with you. What was happening in the home? Were mom and dad getting along? Was mom working in a stressful situation? Were there financial issues? All of those things ultimately have caused the way your biochemistry works in you. Okay, the third thing I want to talk about is hidden food sensitivities. And I wrote down what I call the four horsemen of potential food sensitivities, sort of in the order that they have a tendency to, have prevalence. And so number one is gluten, dairy, corn, and soy. So all of these potential sensitivities can result in ADHD symptoms, and this may happen for various reasons. Sensitivities to food can trigger inflammation, which in turn can affect permeability of the blood-brain barrier, thus allowing those neurotoxic substances more access to brain cells. So that's number one. Absorption of these undigested or partially digested proteins causes the liver to have to work harder and to get rid of these quote-unquote toxins. And so the result of that is less availability to get rid of the xenobiotics that we talked about earlier, even more so in someone who already has a genetic weakness in this area. Hopefully that sort of brings that all together and makes sense to you guys as well. Boy, time goes fast. It's been 35 minutes already. All right, I also want to talk about the sugar connection, because that's a thing that you will read. Studies said, no, there's no connection between sugar and behavior. Now, even though those studies have shown that there's no connection, it's obvious to us that there is a connection. We know that with ourselves and we know that with our children. One of the reasons that the studies may not actually reveal this connection is because when they do the studies, they use a sugar group and a placebo group. But the placebo group has to be tasting sweet just like the sugar group is. So guess what they use? They use artificial sweeteners. And these are chemicals that are actually neurotoxins in and of themselves. And so no wonder there is no difference seen between the two groups, because either you're giving somebody sugar, which can cause a problem, or you're giving somebody neurotoxins that can cause a problem. And that's why they don't see any difference between the two groups. I've certainly found that many children and adults with attention issues actually are hypoglycemic. They have a problem with handling blood sugar. And here's what happens. It starts when you eat a high glycemic food. So the glycemic index of a food is its property of how quickly it will raise your blood sugar. So obviously cakes and candies and donuts and sugar, any sugary thing like that, cookies. But actually anything that's grain-based is high glycemic. So even if you're having a piece of 12-grain whole wheat bread, that causes a sugar spike. So you get that quick rise in blood sugar, and the response by the body is an overzealous insulin response. Because the blood sugar went up so quickly, and because genetically we have never been in our past history up until maybe 7,000 or 8,000 years ago, we did not eat foods that could cause that big of a rise in blood sugar that quickly. When it happens, it's an alert to the body, and the body overproduces insulin. The result of that is then all of that sugar in the blood gets cleared pretty quickly and actually goes below the baseline. The baseline is the amount of sugar that you need in your blood to maintain normal functioning, and that's consciousness. And so you've heard about people going into a diabetic coma. What it means is if the blood sugar goes too low, the body will completely shut down in an attempt to turn off all need for energy so that until it gets restored. That's consciousness, as I said. So when the blood sugar goes below the baseline, alarms go off, and the body's response is to try to convert protein, your muscle, into sugar to raise the blood sugar level. Guess what the mediator of that is? It's adrenaline. So what happens when your body releases adrenaline? You get ADHD behavior. It's hard to sit down. It's hard to focus. It's hard to concentrate. It's hard to stay on task. It's hard to sit. You fidget. This is the link between sugar and ADHD. And you better believe it's for real. So let's get to the plan of action. Hopefully I'm doing okay. I haven't seen any questions yet. So hopefully it's just because I've just been covering the topic so amazingly well that I haven't left any questions yet. Actually, I want to take one step back because I had mentioned gluten. Gluten is a protein that's in certain grains: wheat, oat, rye, kamut, spelt, and barley. And so it's easy enough to avoid those things. You can do it. But there's all sorts of ways that the food industry hides gluten in things as well. And so if you're eating something that's out of a package and you look on the ingredient list and it says caramel color, that actually is gluten. Or vegetable protein, or modified food starch, vegetable gum, oftentimes soy sauce and soy sauce solids contain wheat, the gluten containing. Anything that's breaded, croutons, broth, pasta sauces, oftentimes can contain gluten. And so you have to be careful about that as well. All right, so number one, you got to clean up the diet. You got to get off of the processed and refined foods. And so we're saying this for an adult that has ADHD, or we're saying this for kids that have these problems. You have got to get off the processed and refined foods, carbs in particular, because those are the ones that are causing that sugar spike. So you have to get off of all of the grain-based foods. Now, you do not have to commit to this for a lifetime. As I said in the beginning, I'm about educating people to understand the true ramifications of their decisions. And so, if you have an issue like ADHD or have a child that has this issue, you think of this as maybe a 2 or 3 month experiment, and you follow these steps in the plan of action. And you just do it for 3 months. And then you sit down and say, is there value in doing this? Do I feel different? Is my child different now? And then you can decide. If you were to take 3 months of a period of time and avoid all grain-based diets and follow all of these other steps that I'm going to give you, but you got off of grains completely, and all of a sudden you're staying on task, you feel brighter, you've got better energy, maybe even lost some weight, you slept better, all sorts of things have changed. If you were then say, you know what, pizza's more important to me, well then, that's your decision. At least you would truly understand that the result of having that pizza is the attention issue. Then you can make a decision based on that. Number 3, you got to avoid all other gluten-containing foods, and so that was that cheat sheet that I just mentioned to you. You have to consider those other potential sensitivities. Now, my recommendation, and this is based on my experience with a lot of patients dealing with this issue, is that gluten is the thing, and that's what we get off of first. But if you were to go through that 3-month period and no change has happened, then you might say, all right, maybe it's the dairy, or maybe it's the corn, or maybe it's the soy. And so you have to then, in a stepwise way, avoid those one at a time and see the results. The other thing I'll usually tell people is when you're avoiding something, when you're doing an elimination diet, like if you've avoided gluten, so you do it for 3 months and you feel like a different person, or your kid is a different person. We like to challenge. We like to then take a day where you have 2 servings of gluten-containing food and then nothing for a week, as far as gluten goes, and then see what happens. Oftentimes, all of a sudden, those behaviors start to come back. If they do, then you say, all right, I have to avoid gluten. If they don't come back, then you can say, all right, I can have gluten-containing foods on a rotation basis only, and that means no more often than every 3 or 4 days. So again, you'd go through that same process with the dairy, the corn, and the soy if that were, if you got that far down the road. So basically what I'm saying is that your diet should consist of animal proteins, vegetables, some moderate fruit, nuts and seeds, legumes, and that should be the basis of your diet. If you have a child that has attention issues, especially in school, at home, later, it's not as much of a problem, you can make sure that that child is not having any high glycemic foods for breakfast, because what you're doing is setting them up for that spike and crash as soon as they get to school, and then their behavior is worse. So if you really just concentrate on proteins for breakfast, then when they get home after school, they can have those carbs and you can deal with that. They'll have a better time. And it's the same thing with you at work, Have those carbs for dinner, but don't have them for breakfast. Don't have that bowl of cereal. That's part of what's making you dull at work. Okay, step number 2, plan of action. You have to limit those other environmental exposures. So I'm talking about smoking and plastics and metals. And by the way, I'm talking about recreational drugs as well. Those also have components to it that can lend themselves to having these sorts of problems, right? Step number 3, you have to put attention to the gut. So number 1, deal with those food sensitivities like we were just talking about. Number 2, deal with the good bacteria. And so number 1 is eliminate the factors that are beating up the good bacteria. And again, I would refer you to the probiotic webinar that I did. And then you're going to supplement with good bacteria as well. I'm going to talk about that in a second. You really got to deal with stress and how you're responding to stress. It's so important. Again, another topic of a whole webinar that I did. But ultimately, this is what happens. I deal with patients all day long, and they come in and they tell me that the stress in their lives is caused by their spouse, their parents, their kids, their bosses, their teachers. And then they go out and they get new spouses and parents and kids and teachers and bosses, and the problems are the same. And that's because it's not the outside factor, it's how You're responding to it. If we had a roller coaster and two people were going to go on that ride, one of them loves it. For them, it's exhilarating. While they're waiting in line, they're creating endorphins. Their blood pressure and heart rate may go up in anticipation. They go on the ride. It was a thrill. They get off the ride and it's like, wow, that was great. Heart rate and blood pressure come back to normal, and all the other changes that happen, with a rush of endorphins. All good, positive things. The next person going on that roller coaster ride, for them, it's a white knuckle experience. It scares them. So while they're waiting in line, they're anticipating their death. And so instead of creating endorphins, they create cortisol, the hormone of stress, and that causes some physiological changes. Blood pressure and heart rate go up, blood is shunted away from the gut, other physiological changes happen. They go on that ride, they get off, they still remember when they came near death. All of those indicators don't go down. Their blood pressure and heart rate stay up, cortisol levels stay up. The interesting thing about that illustration is that roller coaster ride was the same for both people. It's not the ride, it's how you relate to it. So the stress part of it has to do with learning to interact with your environment in a different way. And for those of us that are parents who may have concerns about our kids that have this issue, how we deal with stress is how we teach our kids to deal with stress. And that's not something that we do consciously. Our kids see us dealing with stress, and that's how they learn to deal with stress. That's why we see diseases running in families, because we learn from our parents our habits, including the dealing with stress one. And so that one really needs to be taken care of. Sleep, very, very important as well. And again, a topic of another webinar that I did. If you're not getting proper sleep, you're not regenerating and repairing, it's tremendously stressful to your body. And that includes sleep apnea. There are a lot of people who have high blood pressure and diabetes solely because they have sleep apnea, meaning that they don't oxygenate when they sleep. It is a constant trigger to the adrenals that something is not right, constantly creating cortisol, which then leads to those other problems. And so really tending to sleep is important. And then inflammation is very, very important. And many of us are walking around with an inflamed gut without even realizing it. One, because of the standard American diet. Two, because of our stresses. And the result is inflammation. And the result of inflammation in the gut, again, is the result of the breaking down of the integrity of the blood-brain barrier, which then makes those chemicals be able to get to the nerve cells easier, which then causes problems. And so there's a whole protocol that I use sometimes with patients that includes medical foods and specific supplements that take care of the inflammation within the gut. And there are many people who have attention issues who also have, gut issues, irritable bowel, all the way to Crohn's and, all that stuff. Okay, step number 4 is about the supplements. And so again, I like to talk about supplements. I do not like people to think of this part of it, the supplementation, as the only answer, because then you're just doing like medicine does, and you're just taking a prescription medicine that really hides the symptoms instead of fixing the underlying issues. And so all of those other steps, 1, 2, and 3, need to be taken, as well as taking some supplements. So number 1, obviously healthy fats. Fish oil, most important thing that you can do. Helps cells communicate with each other, anti-inflammatory, cuts down on allergic tendencies, helps to reverse leaky gut, helps those brain cells and nerve cells communicate with each other. Number 2, probiotics, good bacteria. And there's a whole world of probiotics out there. There's a whole science to making these probiotics that keep the bacteria alive in the capsule. And there are a whole bunch of products out there which really are not worth the money that you're paying for, because by the time they make it to you, there's nothing live in those capsules anymore. So the probiotic that I use most often in my practice, and the one that I take myself, is by a company called Healthy Origins. It's called probiotic. It's a multi-strain formula. It's very potent, 30 billion bacteria, but not 30 billion at time of manufacturer, guaranteed 30 billion at time of expiration. You look at other products and they say X billion bacteria, you'll see it says at time of manufacture on there. And the other thing I like about this product is it's shelf stable. It does not have to be refrigerated. So it's much easier to remember to take it when it's on the counter as opposed to hidden in the refrigerator. So it helps with compliance. Number 3, multivitamin. Be on a good general multivitamin that gives you appropriate doses of those things that we talked about: zinc, iron, magnesium, B vitamin. So a good general multivitamin. And I'm here to tell you, Centrum and One A Day are not good multivitamins. Those are lousy multivitamins that don't give you proper forms and proper amounts of the nutrients. If you want a good multivitamin that we use a lot in our practice here, it's by a company called Metagenics, and it's called Phyto multi, and it's a good combination of regular laboratory nutrients plus food source nutrients, and it's convenience. 2 caps, 2 tablets a day. We get really good, nice results with that. Very well tolerated. Number 4 is adrenal support, and this comes down to the stress thing. So, one, you have to learn to interact with your environment in a different way. And there are herbs and nutrients that are known as adaptogens. Some of them you've heard of, like licorice or ginseng, and other ones maybe not. Ashwagandha or Schisandra, Arctic root, a whole bunch of different ones. They calm the adrenal response to stress. And when that happens, there's less cortisol, which means less leaky gut. That means less leaky blood-brain barrier. All sorts of help with the stress part of it. And there's different formulas that we use. Some are more energizing, so that would be more appropriate for somebody that when they're under stress, they sort of like withdraw. And then there are some that are calming, and those are good for people that when they're under stress, they like over respond. They get anxious and busy and nervous, and they can't quiet their mind. Then there's some specialty nutrients. So one of them that I will call dopamine enhancement supplements. Now, again, dopamine is the major biochemical here. And in fact, all of the prescription medicines that we would use for ADD, ADHD issues, one way or another, affect dopamine levels. And so you can do that nutritionally as well. And so there's a very specific product called Dopa Boost by a company called Designs for Health that has some specific ingredients that can help raise dopamine levels in a healthy way without causing any long-term problems. There's GABA enhancement supplements. Now, GABA is a different brain chemical, GABA, and that you can think of as the brakes on the runaway thoughts. GABA is what calms down anxiety and nervousness and overthinking, even the up part of bipolar. And so, if a prescription medicine that helps enhance GABA levels would be Valium or Xanax. But those do it in a monkeying with brain chemistry way, whereas there's an amino acid called L-theanine, which can help raise GABA levels in a much more natural way without any side effects. And you will see that there are like a bunch of studies successfully using theanine in children with ADHD issues, and it can be used with adults as well. And then lastly, as far as supplementation goes, is what I call specialty combinations. And so there's a couple specific products. One of them is called Vibrant Mind. That's an herbal, combination that really helps support focus and concentration and memory. That's one that I take before I play poker. Helps me, be able to think clearer and not make rash decisions about things, to think things through. And then there's another one called Attensia by Metagenics. That one specifically marketed for attention issues in adults. It's interesting because one of the ingredients in there is caffeine. A low level of caffeine actually helps with dopamine levels and helps you with concentration. You just don't want to overdo it. And so it's interesting because that product has a little caffeine in it, but it also has L-theanine, which is sort of like the antidote for the negative part of the caffeine. So that's my 4-step plan of action for attention in children and adults. I always tell people this, and I want you to take it seriously as well, and that is that I am here to help support you. Information that I just shared with you is in general by nature, and it needs to be. And you may have individual factors where we would need to adjust an idea here or there. And so if you would like to have some help in applying this information to you as an individual, please email me or call me, or you can do it right through the website. All toll-free numbers and email and everything is right on the website, wellbeinggps.com. And allow me to help you with these issues and see if I can help determine what of all of those factors I talked about are more prevalent in you and what's the best way to sort of help that. Now's a good time to type in any of those questions if you have any. I also want to point out that we do these webinars once a month, we meaning me. And I've been doing them for over 2 years now. And so there are a whole host of topics on the website, things like weight loss and sleep and stress and specific conditions like cholesterol and osteoporosis or, sugar, all sorts of things. And so I would encourage you to go to the website and check out the archives. Also, as you can see in front of you, what's coming up in the next few months. In April, I'm going to be talking about migraine headaches and how it's not just a Vicodin deficiency. That's my own little joke because, in medicine, we think that if you've got a problem, it's just because you've got a deficiency in some prescription medicine. And that's not really the way it works. So we're going to talk about migraines and their causes and how to fix them. Here's a little hint for you. Gluten plays a big role with that. And then in May, I thought it would be kind of cool to talk about traveling and how you can protect yourself. You know, as far as human history goes, our ability to move quickly from one part of the world to another is like it's never been in the past. And the downside to that is that we get exposed to things all at once instead of a gradual exposure. So if you were in the good old days going to travel from China to Europe, it would take you months to do so, and you would do it one step at a time, and you would get exposed to things differently as you went across the continents. Today, you can fly there in 12 hours, and by doing that, you get exposed to things, not completely new things to your system, not in small increments, but in one huge fell swoop. And there are all sorts of ways to protect yourself from that, including what's going on in your gut, and even just if you're talking about jet lag or whatever. So I thought that'd be a kind of neat thing to talk about before the summer vacation season. So that's what's come up. And again, on our archives, all sorts of topics for you to check out. And I really do appreciate your attention. Thank you so much for being here with me today. I honor your willingness to share some of your valuable time with me, and I hope that you have found it helpful. Last thing I will ask of you is that if you have a topic that you would like to see covered in this venue, please let me know. Email me or call me about it, because I'm always looking for new things to help people understand what I'm talking about. Everybody, I hope you have a great day. Thank you so much for being here. Take care.